Thank you, Kathy, and good afternoon to everyone joining us for this session, DBSA's Priorities in Mental Health Equity. I'm Kevin Williams, Communications Vice President for DBSA. I'm very excited to be here with Kimberly King, our Industry Relations Manager, and Robert Dabney Jr., who is the DBSA Peer Apprentice Program Manager. And we're excited to talk to you about our priorities in mental health equity. And Kimberly, if you could go to the next slide, please. I want to start to talk about what we'll share today. The fact that DBSA is committed to expanding resources to historically underserved communities. And today we'll talk about the work we've done to identify where resource gaps exist, because where those gaps exist, there are opportunities. And as an organization, we want to be prepared to take advantage of those opportunities and do what we can to address mental health equity in a way that really narrows the disparity gaps that marginalized communities experience today. In addition, we'll talk about how we can collaborate with organizations serving individuals in the Black and African American communities, as well as other marginalized communities. And we're really excited to talk about and show you some of the things that we've done thus far to address mental health equity. Next. Our agenda will focus on an overview of our mental health equity program, how we got there, and where we see the program going short-term as well as long-term. And that includes a discussion of our program objectives. Next. We started, as we addressed mental health equity, we started with looking at mental health equity and the goals associated with that, and really associating that with the mission of DBSA in terms of providing hope, help, and support to those who live with mood disorders and their families and caregivers. And we came away with some key learnings. Number one is that the efforts in mental health equity reinforce the values that we as an organization have in terms of addressing diversity and equity within DBSA and our culture. Mental health equity efforts are consistent with the DBSA objective to reach, understand, and serve diverse, systematically underserved communities. Our goal coming out of this is to provide access to culturally competent resources and services for diverse and underserved communities of people living with mood disorders and their families and friends. Next. We have to first establish, as we looked at mental health equity, the audiences that we wanted to reach, the communities that we wanted to partner with, and the impact that we desired to make. We started with identifying targeted audiences that we were going to focus on as part of our mental health equity program. We identified the following: communities of color, Black, Latinx, Asian, as well as American Indian, rural communities, because our research has indicated to us that there are distinct differences in terms of how people who live in rural communities understand and approach mental health services. And that community has also been historically underserved. We wanted to target them in our mental health equity program as well. In addition, we wanted to focus on the LGBTQ plus community and veterans. Veterans, through our studies, we've come to understand are woefully underserved in terms of have any access to the mental health services and resources they need. We wanted to make sure that they were a focus of our mental health equities too. Next. The strategy. How are we going to prepare ourselves as an organization to be able to provide competent, relevant mental health equity services? We built our long-term strategy with the following approaches. Number one, we wanted to build a culturally competent organization that collaborates with, understands, and supports the mental health needs of diverse audiences. We also wanted to gather demographic and qualitative data through our chapters and online groups, because our chapters and online groups, we understand, are boots on the ground, so to speak. They have their fingers on the pulse in their local areas. They understand the people in their community, and the information that they can provide to us will be very valuable in helping us to create the right kinds of programs and resources that will be needed by underserved communities. Another key step as part of our strategy was to hire a diversity, equity, and inclusion consultant to improve our ability to expand outreach to a wider, more diverse audience. The consultant is going to be valuable in helping us to talk and speak in a culturally competent way to underserved audiences, to make sure that our approach to these audiences is one that is knowledge-based, one that has credibility, because that's going to improve our ability to make relationships, to engage these audiences, to build the trust and to form the partnerships that DBSA will need long-term to be able to offer and provide resources and tools in the mental health space to help these audiences get the support that they need as far as their mental health wellness. We also wanted to train our staff in culturally competent writing and communication skills. We know that communications is the first evidence of knowledge and understanding that we can bring to underserved communities. If we communicate with them in a relevant way, in ways that they're familiar with, in ways that position our services in such a way that they can understand the need for them, and in fact, will ask for them, we want to make sure that our staff is prepared to do so, because that's going to help us cement the long-term partnerships we'll need to be long-term players in the mental health equity space. Finally, we want to develop coalitions with diverse mental health providers, whether it's social workers and others, who will help us in our outreach to more diverse clientele. Much like our desire to work with chapters and online groups, the mental health providers are going to be another set of boots on the ground. They will have their ears to the ground in the local communities. They'll be able to educate DBSA on the proper priorities and concerns that underserved communities have about mental health. And that's going to inform the programs that we can develop that will be seen as relevant and needed by these communities. Next. Let's take a quick look at the objectives. Once we've laid out our position of how we're going to get there, these are the objectives, short-term, mid-term, and long-term, that we plan to accomplish as part of our mental health program. In the short term, DBSA will understand points of concern for underrepresented communities regarding mental health and wellness. We will also form partnerships with key organizations that will introduce us to those underrepresented audiences and will be an ally in helping us to distribute our services and our resources. And we'll engage with representatives from underrepresented communities when discussing mental health equity issues. Next. In the midterm, our objectives are as follows. DBSA will build the infrastructure and competencies to articulate top priority issues of concern for underrepresented communities. Going back to an earlier point I've made, we want to be able to speak credibly and knowledgeably about mental health as it relates in a relevant way to underrepresented communities. This will break down barriers of trust. This will open up access and increase possibilities for partnerships. DBSA can frame mental health issues for posting on social media, website, and other digital platforms. As we understand better how to convey mental health equity issues to underrepresented communities, we want to deliver this content on our digital platform so that we can reach a broader cross-section of people. And we want our support groups to expand access for underrepresented communities. We've had success this year already in the opening of online groups for the Black community. And we want to continue to expand support groups that will meet the needs of other underrepresented communities. Next. And then long-term, our objectives are to build these long-lasting partnerships with organizations that represent underrepresented communities. For example, communities of color. Here in Chicago, for example, we're very excited about a partnership that we've launched recently with the Chicago chapter of the National Urban League. And in the long term, we want to build similar partnerships with similar organizations like that around the country. We want to establish a reputation for DBSA as an organization that knows how to deliver mental health and wellness resources to underrepresented communities. And we want the coverage. We want to receive coverage through social media, earned media platform that will tell the story of our organization as a thought leader that's known for delivering mental health resources to underrepresented communities. And with that, I'm excited to introduce Kimberly, who will talk more about the partnerships that we're building to help us address mental health equity.
Thank you, Kevin. I am so excited to be here, and it's a pleasure to be in attendance with you this evening. I'm here today to talk about the ways that DBSA National is working to develop strategic partnerships that support our short and long-term financial sustainability to our work in mental health equity, particularly as it pertains to DBSA's efforts to be more inclusive and provide hope, help, support, and educational resources to those who live with or are impacted by mood disorders in historically underserved communities. Now, I say all that to say, and you're probably wondering, now what does she mean by building strategic partnerships that support long and short-term sustainability for financial stability? That's a mouthful. It sounds a little jargonish. So I'm going to break that down to more simpler terms. So basically, I'm going to take a deeper dive into two key types of partnerships or relationships that lead to strong and strategic relate partnerships. These are both our funding partners, which we're going to talk about here shortly, as well as our community partners. As it pertains to our funding partners, you can have all the great ideals in the world and want to change the world, but you can't do that without funding, which is part of my role as an industry relations manager and working with our corporate partners to establish funding sources. And there's different types of funding sources. And the two here that we're going to talk about are government funding and corporate and foundation funding. So starting with government funding, and the reason why I'm starting with this, not just because we're talking about, in this case, the federal government, is because the work we're doing with SAMHSA, also known as, or more formally known as the Substance Abuse and Mental Health Administration, the work we're doing there has really served to anchor the work that we're doing and it connects in so much of the short-term, mid-term, and long-term goals that Kevin referenced earlier. So DBSA was awarded a 3-year grant from SAMHSA to support our peer support apprentice program, also known as the Consumer Enhancing Network Program grant. There are 3 key goals of this program. One is to expand peer support, expand the peer support specialist workforce in Illinois by training and mentoring Black individuals on a career path as Illinois Certified Recovery Support Specialist, or CRSS, which is the official name given by the state of Illinois for peer support specialists. And my colleague, Robert, who I'm so excited to have here with us in the latter half of the program, will talk more specifically about this because it pertains directly to his work and gives life to the things that Kevin and I are both referencing. Goal number 2 is to develop and execute a pilot program to broaden peer support and reduce stigma within Black communities in Cook County that is replicable and scalable to improve mental health outcomes for Black individuals within the state of Illinois. As most of you know, there is a lack of mental health professionals available. And when it comes to those who represent the Black community, there's even less. So this is an opportunity for DBSA to create a program that helps to, 1, reduce stigma, and 2, also address the issue of representation by having creating a program that allows more individuals in the Black community, and particularly in Cook County, to have access to the training, to understand its relevance to mental health, and to create support a sustainable job force for individuals of color, and particularly the Black community. Goal number 3 is to increase the capacity of the organizations in Illinois to provide peer support specialists, apprentices that support individuals from training through certification as peer support specialists. That's a mouthful as well. What that really means is that DBSA, as many of you know, DBSA is one of the pioneers of the peer support specialist training course that is utilized and recognized by the Veterans Affairs Administration. But the challenge with that is that although we have a course, we do not certify. Certification requires additional hours, and it varies from state to state. Here in Illinois, it's much as 2,000 hours that are typically unpaid to complete the work you needed just to take the state test. So this program actually, rather than giving you the training course and sending you off into the world to figure out how to get those additional hours on your own, actually gives you the foundation to actually get those apprentice hours and be prepared for your certification testing. Pardon me, my cursor has suddenly disappeared. There we go. And then the second type of funding partnerships we want to talk about is corporate and foundation. So DBSA has already had established partnerships with many of the partners you see here, but we have some new partners. And this is all based on partners who are entities that have the resources to invest and the commitment to invest in this particular issue of mental health equity. So DBSA has partnered with Alchemies and the Alchemies Inspiration Grant. Alchemies is a pharmaceutical company, and they are providing us with support for peer support groups and increasing the capacity of our chapter network to do the same, meaning that our local chapters will have the opportunity to be supported in their efforts to have support groups that strive to serve those in historically underserved communities. We also have another partner, Otsuka America Pharmaceuticals. They are providing us support for our peer support groups along that provide one-on-one follow-up for a peer support specialist. So in addition to having your traditional support group, DBSA National will have online support groups that will also provide the services if one chooses to have a peer support specialist work with them one-on-one. Janssen Pharmaceutical Companies of Johnson & Johnson is also providing support for peer support groups with the one-on-one follow-up from peer support specialists and that funding also covers marketing support and to increase access to peer support in Black communities. So meaning promotional materials, things of that nature to get the word out in the communities. And last but certainly not least, we just recently received a grant from 2 foundations that are working in collaboration. That's the Boeing and McCormick Foundations. And that is for peer support specialists project focused on veterans, which you'll hear more about again from my colleague, Robert. So the next relationship I want to talk about is community partnership. And as Kevin referenced earlier, DBSA is very excited to have in the very early stages of development of this program, a partnership with the Chicago Urban League. Since our efforts on a national level are being, this is the first time we're doing this, we're piloting in our own backyard so we can take those learnings and transfer and apply them as we expand into other underserved communities. So Chicago Urban League is serving as a partner in that space to introduce us to community service organization and members of the Black community. For those of you that were part of the previous session with Dr. Stewart, where she was talking about the more systemic issues that pertain to mental health equity, it's very important for DBSA, and we've been very conscientious about understanding that historically we are, as an organization, have not done direct mental health equity outreach. And in order for us to do that and be effective, we are not here to be the saviors, or to parachute into the community to tell them this is what they need to do, but rather to introduce ourselves as an organization and the concept of peer support and share with the community about ways they could be involved with this and get support from our organization and our programs and services. And they are also part of the SAMHSA grant. And actually all the partners I'm listed here are also part of the SAMHSA grant. So they're all interconnected. So when you hear us talking about these things and hear mental health equity, and then you hear us talk about the Black communities, understand that's all under the same umbrella. Fresh Shows, which is a mental health organization here in Chicago, is actually going to be providing our peer support apprentices with actual practical hours of time or internship or practicum, where they can actually apply their the learned skills in a mental health facility under the supervision of clinicians and mental health professionals. And then we also have our support of our DBSA Chapter Support Network, the development of local support groups for the BIPOC peers. We know each of our chapters we have chapters all over the country, and they each have areas of interest in this space, and we're hoping to work more with those individual local chapters to support their efforts as well. And I'm going to stop there and see if we have any questions in the chat box here. And we do. So we have Jonathan P. He says, I appreciate all the goals. I wanted to be a peer support specialist for years, but could not afford it. Will this program create scholarships or subsidize the peer support specialist training? So I know Kathy, our Zoom jockey, is working on answering this in writing, but since I addressed the question, what we're hoping is to continue those efforts. What we're doing now is a pilot program, but we are working to sustain funding that will allow us to have more scholarship opportunities. So more hopefully to come on that. Let's see, do we have any other questions? Okay, I got another question for Eric Sharp. Can you say more about chapters around the country that are addressing these issues? That's a really good question, Robert. Robert. I was say Robert. Eric. I cannot speak to this. However, you can reach out to our chapter relations team, Carlo DeForio, to our chapter relations director, to find out more specifically about what our chapters are doing individually, because we have such a large network of chapters and they speak directly to our chapter relations team. They can give you more information as it pertains to that. And I don't know if we have time for one more question. Is it too late to join the Peer Support Specialist Apprentice program? I'm going to let Robert address that question because he is the man as it pertains to this program and can tell you more about where we are with the program and what the next steps are. So without further ado, I'm gonna introduce Robert Dabney Jr.
Hello, thank you, Kimberly. Thank you, Kevin. And thank you, Kathy, even earlier for just getting everyone here and prepared for this part of the meeting. I want to just inform everyone that what we're about to talk about now is the practical applications of everything that Kevin and Kimberly covered. And so just a little introduction. I'm Robert Dabney. I serve as the DBSA Peer Apprenticeship Program Manager. But before coming here to DBSA, I served 9 years as a combat medic in the U.S. Army and 3 years as a hospital chaplain. So these occupations instilled in me a strong desire to always be of help or assistance to other humans. So the fact that I get to help or work with DBSA to build this program is a real honor for me. And I look forward to, as Jonathan is asking questions, bring more people into it and help more people find out about it, because it's something that will make a difference in our communities. Just real quick, as an Army medic, I discovered the greatest aid I could provide for someone was a listening ear. And my role as a healthcare chaplain taught me the value of sitting with someone during their pain without ever speaking a word. And it's from these personal experiences that I have discovered the value of peer work. And I try to instill in help to our apprentices to have a good understanding of that as well, because before we know it, we all will have an opportunity to serve someone else that may be experiencing a mental health crisis. So next slide, please. Just a little bit about what peer specialists are. There's a difference between peer support groups and peer support services. Just as a quick overview for those who may not be aware, peer support groups are support groups that are led by individuals with lived experience. That means they are people that have themselves experienced substance use disorders, or there are people that themselves that live with mood disorders. And these are the individuals that lead our groups. They aren't licensed therapists unless they are peer specialists as well. They aren't doctors. They're everyday people that have lived and are currently lived through a serious experience and are currently in a state of recovery that are leading out these groups. So it's individuals that have a great understanding of what someone else may be going through. Now, peer support services are activities and interactions between people who share similar experiences. They share their experience, their own lived experience, as a practical guide to help others, again, see that it's possible to come from where you are and make it to a point of thriving, or at least living in a happier state or a better state of life. The peer support services seek to help people develop their own goals, create strategies for self-empowerment, and take concrete steps towards building fulfilling, self-determined lives for themselves. Next slide, please. So as you can see here, DBSA does have a history of peer specialists, or helping people become peer specialists. Our first program began in 2006. It was here that we began offering a course where individuals could come for and learn about the requirements necessary. We would provide them with the information, and then they would go on and certify. But as time has went on, the program has expanded, and now we offer a 76-hour course, which is one of the most extensive in the nation. And as it says here, in 2012, we began a contract with the VA. And I just, as a veteran myself and a team member here at DBSA, I am glad and proud to say that DBSA's peer specialist course is only one of 2 approved courses that are available, that the VA makes available to their employers that are looking to become peer specialists. So that says a lot about the program that's being offered through DBSA. But today, DBSA began doubling down on their commitment to peer services by offering a 2-year apprenticeship program. And in this program, individuals will go through the first year with myself at DBSA, and that's where we'll kind of tackle the educational requirements, which we'll get to soon. And then the second year, they will go on to an organization here in the local area called Thresholds. Thresholds is a community service organization that serves many people that are kind of underrepresented and in need of the greatest amount of assistance, whether through substance abuse, homelessness, or mood disorders. They have programs for them. And so we've been able to partner with Thresholds to offer the second year of the program to our apprentices to go there and work on the job training. And so as Kimberly was alluding to earlier, typically if someone wants to become a peer specialist, they would be required to go out, find those volunteer hours, find some place to help out and assist, and have it supervised by a certified peer specialist. But thankfully now through DBSA's pilot program, we're able to provide not only the educational piece, but connect them with organizations that can provide that additional supervised training. And throughout this entire time, our apprentices are paid. They are able to continue to live their lives and take care of their business while also getting the certifications or the resources for the certifications they need to become peer specialists. So next slide. So this is our peer apprentices here. There's 4 of them in our first cohort. And I just want to really, again, point out the fact that DBSA has made a significant commitment to focusing on addressing the inequalities around access to effective mental health care in Black, Brown, and Indigenous people of color communities. And this picture is proof of that. To do this, we are building out this program, this 2-year program, which will provide those future peer specialists with the resources, training, and educational curriculum to successfully reach their goals. In our first cohort, as I said, we have 4 individuals who are from Chicago's Black and Indigenous people of color communities. 2 are veterans, 2 are civilians, and together we meet, we have real conversations. It gets very vulnerable, but there's an opportunity for us to share and to support one another. And it's in that sharing in this small room here that you see that we learn to support one another. They also are learning to support individuals that they are meeting in the community. And so, yeah, with their lived experiences, we are learning to use those experiences as a tool to help others find their way to wellness. Next slide, please. So here's a little breakdown of what our apprenticeship program looks like on a weekly basis. For those who are interested, just so you know, we first began August 2nd. So we are ending 2 months now of our program, and it's been going great. The individuals that are taking a part have come a long way in their leadership skills already. And I'm excited to see what happens after a year and a half as they go out into the community and make a difference. But in our courses, they include subjects that are taught by subject matter experts from fields of professional development, mental health advocacy, both on the local and a national level, community organizing, and utilizing community-based participatory research in partnership with the Illinois Institute of Technology and other local community organizations that are serving actively the Black and Brown communities of Chicago. Our practical hours include co-facilitating or helping to lead out in a peer-led support group, responding to DBSA's info line, and also they participate in weekly mentoring sessions with myself and other certified peer specialists that help to answer any questions that may arise over the week. As we go along between August of last year and the end of the program, we have a big document that tracks their hours, tracks what they need, tracks how far along they go till they have all their certification. And in this way, we're helping to not only give them the required resources, but ensuring that they have their paperwork and documents together so that all they'll need to do is sign up for the test and go and take it. And we believe that we'll have a high success rate in that. Next slide, please. So here's a picture at our first community event. It happened August 21st, excuse me. It was with the Chicago Urban League, as Kevin and Kimberly mentioned, our partnership with them. Here we had a table, we set up, we offered resources, information, and just conversation around the topics of substance use disorder and mood disorder. And what we found was that the individuals in that community was so happy to see that it was us that was coming to them, meaning community members, people that look like them, that were coming to share our experience with them about mood disorder or substance use disorder, and also telling them about resources that we found that's been helpful. And in this way, people, they opened up. They started telling us about their uncles, their cousins, their brothers. Very few people talked about themselves, but it did happen. And they were very excited to know that DBSA as a national organization was taking an active concern in the mental wellness of the Black and Brown community here in Chicago. And so there's been a lot of positive feedback from the community as we go forward. And I'll be able to get into a little bit more about that as we prepare to launch a few peer councils, and I'll get into that later. But yeah, community members were very enthused. They were happy to learn about peer support and the fact that even they, without their college degree or without any type of schooling, could use their own experience which they believed excluded them from any real careers, could use their own experience to help them find employment and to help other people. So that's the message that we've been pumping out into the community here in Chicago, and that's what we want people to know about peer services and the value it brings to everyday people. Next slide, please. So as we move forward, following that first community engagement event, we did have a second one, and it went just as well. But starting from, well, it started this month, we began to assign the peers or allow them to choose mental health coalitions around the nation that they are able to sit in on the meetings, hear about what's going on on the larger scale of mental health, mental wellness around the nation, and just allow them to hear those conversations and get a feel for what the work really is like. Right now, we aren't communicating or that active on those coalitions. We're just learning, we're just listening, but in about a month or so, they'll be ready to add their own experience to those conversations. And that's something else I'm looking forward to. As you see here, this is myself and two of the apprentices. Nicole on the left is one of the veterans, and Wayne on the right is one of our civilian apprentices, and that's me, of course, in the middle. But all three of us are a part of mental wellness coalitions. All three of us are a part of different mental wellness coalitions. And for example, we attempted or encouraged the peers to find a coalition that speaks to their experience, speaks to something that they feel that they could really contribute to. And so just as an example, one of the coalitions I chose was the Interfaith Mental Health Coalition. It's a group of spiritual leaders throughout the city of Chicago that comes together to talk about ways we can address mental health, mental wellness in our community. So these are a few of the things that the peers have gotten started with. We've also begun groundwork on peer councils. Now, these councils will be led by our apprentices and will work to discover the most impactful methods of offering peer service to our communities, one neighborhood at a time. Now, this is where community organizing and using research methods like community-based participatory research will come into practice. So we meet each week and we learn from professors from the Illinois Institute of Technology around leadership, group facilitation, and the research project, community-based participatory research. We learn from them on a weekly basis how to operate and how to lead out in those groups. And so our four apprentices who had never had this type of experience or exposure are now getting this on a weekly basis with the goal of them going out into the community and standing up and setting up a peer council themselves. And just really quick, a peer council, what that is, it's a way for us to partner with our community organizations and put together a council of individuals, peers, that are able to provide this research or these questions or these surveys to individuals in their communities so that we can hear firsthand from those communities what is needed, what has been missing, and what they believe will be helpful. And as we gain this information, we bring it back and we begin to incorporate it into our research, into our programming, and into our plans. And next year, when we begin another cohort, we will form another peer council and we will go out and add to this research. And so the idea is to continue to go into our communities, continue to ask questions, continue to receive feedback while allowing our peers to interact with their communities and just be of service in any way they find helpful using their own lived experience. And next slide. And there is so much more to come. Again, we begin August 2nd. This is ending the second month of the program, but we're very excited. We have a lot of things planned. And as the question did arise earlier about upcoming apprenticeship programs, if you would like more information, please email me. I can be reached there. We do have we are planning to begin a cohort in beginning of January of next year. So the details are still out on that, but that's what's coming. Thank you, Kimberly.
Thank you, Robert. That was a great presentation. Hopefully everyone that's in attendance here learned a lot. Let's see if we have any more questions. We have a few more minutes. So let's have a question. We have a question from Eileen Phillips. Eileen says, this pandemic has had a big effect on first responders and nurses, EMTs, which has put a highlight on the need for more programs. Is there a plan to add a connection to the American Nurses Association?
So this is Kathy in the background, and I'm going to unmute because I kind of know a little answer to this. I do know that our leaders in our peer support space, Douglas Holt, is working on a peer supporter program for first responders, and more to come on that in the near future. Or maybe Robert knows more than that, but we are cognizant that this is a need.
Thank you, Kathy. And so while we're waiting this pause to see if there's any more questions, so just want to thank everyone for being in attendance here late in the evening on a Tuesday. We hope you found this informative. We welcome you to reach out to any of us here on this call, on this session, for more information, whether it's pertaining to communications, the overall plan, that would be Kevin Williams. If it's regarding developing relationships and fundraising, that would be myself, Kimberly King, and directly for the Peer Support Apprentice program, that will be Robert. And check one more time, see I've answered everybody. I think we got everybody, and I think that means we're gonna wrap up. So thank you, everyone.